Welcome. I'm Jessica Tomaszewski. I'm a pediatrician at Nemours AI DuPont Hospital for Children in Wilmington, Delaware, and I'm going to talk to you about a new article on breastfeeding. So let's start with a clinical vignette. A stressed mother presents to your office with her infant for her 6-week visit. The baby has been gaining weight well, developing appropriately, looks really good. But the mother is reaching the end of her maternity leave as a busy high school teacher and is really worried about her transition back to work. So she'd like to continue to nurse at home, but she's very concerned she won't be able to pump a sufficient volume, both in volume or perhaps in time and frequency of pumping, to allow her infant to fully subside on breast milk alone. She feels discouraged by some of her friends and even social media that supplementing her infant with formula may lead her infant to no longer receive the benefits that breast milk provides. So, as you encourage and support this mother, there are a couple different directions we take. First, if she desires to pump at work, we should inform her of the federal laws that require adequate break time and location to do so. One of the areas that you can direct her is to Kelly Mom, which is a wonderful resource for both savvy breastfeeding mothers and providers. After you've established her pumping support, you also recall interesting findings from a study by Thompson et al. That looked at one particular benefit of breastfeeding, the prevention of SIDS. We're not totally sure where this protective mechanism comes from, but there is evidence that it exists. So this particular study looked at how long, that duration of breastfeeding, you really need to require to see that protective effect. And let's talk about a really interesting way to help support and empower your mom here. So let's talk a little bit about breastfeeding. So what we know is protecting and supporting breastfeeding should be a public health priority. There's well-established benefits for infants and mothers. There's reduced risk of disease for both involved. The CDC estimates that low rates of breastfeeding add more than $3 billion per year to medical costs for mother and child in the U.S. alone. The American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months of a baby's life and continued breastfeeding with complementary foods until at least the age of 12 months. The current U.S. rates of children that were ever breastfed are estimated around 82%, which are a little bit higher than they've been in the past, but they dropped to around 55.3% by 6 months. There are several factors that involved in this drop, some of which are illustrated by the vignette that we've talked about. These rates are even lower in populations such as non-Hispanic Black infants. So this article by Thompson et al., entitled "The Duration of Breastfeeding and Risk of SIDS," was an individual participant data meta-analysis. This was in an online study in pediatrics in October. They analyzed over 2,000 SIDS cases with just under 7,000 control infants from 8 SIDS case control studies that included breastfeeding data. These individual study analyses and pooled analyses were performed, and they focused on multiple factors, breastfeeding included, but also things as maternal education, sleep position, maternal prenatal smoking, pacifier use, and more. In a multivariable pooled analysis, breastfeeding for less than 2 months was not protective, but at 2 months, the risk of SIDS is reduced nearly in half. This risk continues to reduce as the breastfeeding relationship continues at 4 and 6 months, but that 2-month point is extremely critical, as it really is right around that point where this particular mom in the vignette and many other mothers in your practice are potentially looking to return back to work. And the other really empowering fact that this study encourages is that any breastfeeding, whether it's exclusive or inclusive, for 2 months or longer did have a protective effect. So any breastfeeding that was happening, even if there was supplementation with formula, had the same protective effect against SIDS. So what does this study add? So like we were saying, infants who were still receiving breast milk at 2 months in some quantity received a protective effect. 6 months of exclusive breastfeeding can be a challenging goal for many families. Starting with these short-term goals such as 2 months that are unaffected by supplementation may encourage mothers to continue for as long as possible, which is really what we want as pediatricians. Concerted efforts are needed by healthcare providers to focus on the maintenance of these breastfeeding relationships. Some of the limitations of the study that we notice involve the inherent challenges of combining data from these case control studies, but the size and the level of analysis really allows us to spread this data with our families and continue to encourage them to breastfeed as long as they possibly can. Thank you very much.